Hi, I'm Roshwin, a dentist based in the UK with my practice mainly focused on dental implants. In this video, I'm going to answer some frequently asked questions about dental implants. Dental implants are screw-like looking artificial tooth root replacements that fuse with the jawbone. They provide a stable foundation for fixed or removable replacement teeth to go over. They not only resemble natural teeth but also function like them, allowing you to eat most foods comfortably and smile confidently. Dental implants offer a natural looking, feeling and functional solution for replacing missing teeth. A good candidate for dental implants typically has good overall health, has healthy gums and adequate jawbone structure, although this can be rebuilt if necessary. Additionally, ideal candidates are those who have or can develop good oral hygiene habits. With proper care, dental implants can last a long time. Studies show that implants can last for around 10 to 15 years, but I have seen implants fail within a few years and others that have lasted for over 30 years. There are many factors that contribute to their longevity. Dental implants have a success rate of over 90 to 95% at 10 to 15 years. With modern techniques and proper planning, the outcomes are highly predictable and successful. The procedure itself is not painful. Most patients report that the procedure is much more comfortable than they anticipated. This procedure is carried out under local anesthesia and can be comparable to having routine dental treatment. After any oral surgical procedure, there is likely to be minor discomfort in the area. The level of discomfort depends on the specific procedure. Patients having a single implant placed often report minimal to no pain at all after surgery. However, those undergoing more invasive procedures such as major bone grafting, sinus lifts, or full mouth implants may experience slightly more discomfort, swelling, or even puffiness in the area. Most of these symptoms can be effectively managed with post-operative medications and proper aftercare. Again, this varies from case to case, but on an average, expect soreness or tenderness in the area for a week to 2 weeks. We normally book a longer appointment, but in general, the procedure for a single implant can take around 20 to 30 minutes. The length of your treatment really depends on what is necessary for you clinically and the treatment techniques being used. This can vary from 3 months to sometimes even just under a year. We do stress out about the few extra weeks the treatment will take. However, we have to remember that we are having dental implants for its long-term benefits. We need to give it time to ensure it is successful. And if you are worried about having a gap in your smile line, we will always give you a provisional replacement tooth during the whole process. Dental implants offer a long-term solution, prevent bone loss, do not affect neighboring teeth, and provide the look and function of natural teeth. I will elaborate the difference between your other options in another video. As with any surgical procedure, there are risks, including infection, swelling, damage to adjacent anatomical structures, and implant failure. However, these are minimal or rare when performed by a qualified and experienced professional. Care for dental implants involves regular brushing, flossing, and routine dental checkups, just like with your natural teeth. The cost of implants varies depending on the number of implants needed, the complexity of the procedure, the bone structure available, and your geographic location. It's best to consult with your dentist for a detailed estimate. Feel free to get in touch if you'd like us to give you an estimate. The initial cost of dental implants is generally higher than alternatives like having a bridge or dentures. However, if a bridge fails and requires replacement, the long-term costs can exceed those of a dental implant. Additionally, not replacing the missing teeth can have long-term functional and structural impacts on your mouth, which can be more costly in the long run. It's important to evaluate all your options and determine what is best for your individual needs before making a financial decision. Yes, as long as the patient is in good health and has adequate bone structure and good oral hygiene, age is not a limiting factor. I feel proud to say that the oldest patient I treated was 99 years of age for her first implant and 100 when she decided she wanted to have another one. What an incredible lady. Implants prevent bone loss, maintain the integrity of your facial structures, do not affect your adjacent teeth, as well as help you chew your foods properly, contributing to good overall oral health. Let me share a story. I had a patient come in wanting full mouth implants, and although she was medically fit, she seemed frail and pale, and I was worried about how she might cope with the process. Thankfully, everything went well, and the change in her after was immense. She was glowing and seemed like she had a new lease of life. This was not to do with her smile, but by the fact that she could eat properly again. Immediate dental implants, although technically more demanding for the dentist, they tend to result in better outcomes. You can have an immediate implant placed if you have enough bone structure to support an implant, and secondly, there is a lack of active infection in the area. You wouldn't want to place an implant in an infected site. Of the cases I do that need an extraction, 75% or more of these tend to be an immediate implant placement. The surface of dental implants is typically made of titanium oxide. This material is biocompatible and promotes osseointegration, allowing the implant to fuse effectively with the jawbone. Will the airport security buzzer go off when you walk through? Thankfully not. The number of implants you need can vary based on the number of teeth missing. It's unlikely you need to have one implant per tooth missing. Quite often we can have a bridge or link multiple implants to be able to replace multiple teeth. In full mouth cases, often 4 to 6 implants are sufficient to support 12 to 14 teeth on a single jaw. Simple. Contact us or a dentist nearby for a consultation to assess if you are suitable. If you are suitable, we will normally prescribe a bone scan to assess the available bone and also to help us digitally plan so you can have a successful outcome once we start your treatment. Hygiene, and good hygiene. I cannot stress enough the importance of good oral hygiene, as I have seen implants that were failing still working because of improved oral hygiene. So how do you clean? Brush twice a day, as you should, especially along the gum line of the implant. Use interdental aids like a floss or interdental brushes, although the floss is more effective. I have also got good feedback about the water flosses that are now available. It's not that smokers can't have dental implants, but it's important to note that smoking can increase the risk of implant failure. Smoking affects the blood flow and healing, which can impair the osteointegration process and increase the risk of infection. Smokers are advised to quit or reduce smoking before and after the implant procedure to improve the chances of a successful outcome. It's crucial to discuss your smoking habits with your dentist to assess the risks and develop an appropriate treatment plan. If you smoke around 10 to 20 a day and do not think you can or want to stop, I would say avoid having dental implants. People with osteoporosis can have dental implants, but there are additional considerations to keep in mind. Osteoporosis can affect the bone density and healing, which may impact the success of the implant. It is essential to have a thorough evaluation by a dentist or a specialist to assess bone quality and determine if any additional treatments or precautions are needed. Teeth in a day is a commonly used marketing term. This is a procedure whereby 4 to 6 dental implants are placed in a single jaw and a fixed bridge of teeth are placed on the day. It's ideal for people who have no or few natural teeth. However, treatment is not completed in a day and the patient walks out with merely the provisional teeth, and they need to come back in a few weeks or months for the final bridge fitting. Peri-implantitis is the most common cause of implant failure. This is an infection of the tissues around a dental implant which causes the loss of bone and gum around the implant. If left untreated, it could cause serious problems and eventually lead to failure of the dental implant, which may then need to be removed. This infection is most often caused by poor oral hygiene, so it's essential to keep your dental implant clean and attend all your dental appointments. Quite often we find that patients may not have sufficient bone necessary for implant placement. If this is the case, we tend to use artificially derived or bone derived from either human donor bone, animal bone, or even one's own bone in order to build up the bone in the area to allow for implant placement. This procedure is called as guided bone regeneration. This may increase the time of treatment, but will give you the successful outcome that you need. If you have any further questions about dental implants, please feel free to leave it in the comments below and I will try to address it